So my name is Mary Oyos, and I'm a diabetes clinical nurse specialist and diabetes program manager at Avera McKennan. Certainly for everybody, just like for everybody, COVID has been a very stressful time. Everybody kind of jokes in our department that I'm the department mom, and I definitely felt that way at many times, trying to keep up on all the different policy changes and everything needed to keep us healthy and most importantly to keep our patients healthy. We do diabetes education for inpatients and outpatients, and some of the most challenging things have been the inpatients that were diagnosed with COVID and diabetes at the same time. A lot of these people did not get routine health care, so they came in with no insurance, no job, no prior health care, and they were coping with diabetes, COVID, sometimes other chronic conditions that were diagnosed at the same time. And so it's very challenging trying to help them navigate that, knowing that diabetes wasn't really their first priority, but yet it really needed to be to keep them healthy into the future. And so that was something that has been and continues to be very stressful for our team, as we're very concerned for those patients. I think that can kind of be best summarized. One example is our office now is a new location. Throughout most of COVID, we were located next to the helicopter pad. And so I just kind of got used to that sound over the years and didn't really pay much attention to it. And remember one day early in the pandemic, I suddenly became aware that helicopters were landing and taking off constantly. And knowing that most all of those were COVID patients, knowing not all of them would leave the hospital alive, thinking about the patients, everybody taking care of them. I remember that as a day that just kind of, the gravity of all that just really kind of hit me. Early on, the stress of everybody had of, working in healthcare. What am I bringing home? Am I going to get this? Is my family going to get this? That was definitely a stress. And then, again, just kind of worrying about everybody in our department, trying to support coworkers and just, being there for everybody definitely was stressful. Yes, working at a faith-based organization with the mission that Avera has always been something that has meant a lot to me. And I think especially during COVID, all of our meetings always begin with prayer, but especially during this difficult time, all of those prayers and reflections centered around COVID and how we could support our patients and support each other. The sisters are wonderful at, praying for us and just being there in any way that we need. So that has been extremely meaningful and been a great source of strength and support. So my faith has definitely been a source of strength during this time. I've always felt that my job as a nurse is a ministry. And so, again, working at a faith-based organization, that has always been a very good fit. And in all the challenging times, my faith has just helped me to know that God is there walking with us. We all have those questions related to the pandemic of, why did this happen and how long is this going to last and can we get through this? And faith has definitely sustained me during this time in a major way.